Hi, this is Deguire, and it's a biomechanics video. Got a few definitions to start us off. First one is flexion. Is the bending movement in which the relative angle of the joint between two adjacent segments decrease. Extension. The action in which the relative angle between two adjacent segments gets longer. Rotation. A movement about the axis of rotation in which not every point of the segment or body covers the same distance in the same time. Abduction. A movement away from the midline of the body. Adduction. A movement towards the midline of the body. Supination. A movement in which the back or dorsal surface rotates upward as seen in the forearm and foot. Pronation. A movement in which the forward or ventricular surface rotates to face downward as seen in the forearm and foot. Circumduction. A movement in which is a combination of flexion, abduction, extension, and adduction. Elevation. Rising of the scapula as seen in shoulder shrugs. And last but not least, depression. The lowering movement of a body part such as the scapula. Well, let's start off with the movement portion of the video. First we'll start at the anatomical position. You start with your hands down to the side, and then anatomical would mean palms up. And the next we'll go to the neck. Flexion is when you go down, extension is back to normal, and then rotation is to each side. Next we're going to go into the shoulders. First we're going to start with elevation, which is just a basic shoulder shrug, and then depression is back down. Then we're going to go into abduction and adduction. Abduction is away from your midline of your body, and adduction is back towards the midline of your body. Again, so abduction, adduction. Then we're going to flexion, extension. Make sure you have your thumb up, and you flexion's up, and extension's back down. And then circumduction, circle. So circumduction is when your shoulder goes all the way around. Now we're going to go into the wrist and the forearm. First one is going to be flexion, then it goes into extension. Flexion, extension. Then you go down in the arm into the fundamental position, and you go supination and pronation. So supination is facing you, and then pronation is when your palm is facing back. You go into the fingers. This is abduction is away from the midline, and adduction is towards you. So abduction, adduction. Now we're on to the trunk and the hip. First we'll start with the trunk with flexion, which is flexing forward. Extension is back up. Rotation is when your hips rotate. And then we're going to the hip. So we have flexion, and then extension is backwards. So flexion, extension. We got abduction and adduction. Abduction's away from the center line of your body, and adduction is back. Then you go into circumduction, which is when your hips are in a circle. Now we're on to the knee and the ankle. First on, we're going to go to the knee, and knee extensions would be pulling it out, and flexion would be back. So leg extension and flexion. Now we go down to the foot. So when you point your toes, that's plantar flexion, and then when you go back, that's dorsiflexion. So when you point your toes, it's plantar, dorsi, and then when you go to inversion, it's like you're rolling your ankle, and inversion is when you roll it this way. Done.